we're going to listen to Dr. Joe. Well, we're not going to listen. I'm going to tell you what Dr. Joe Gifford. She was halfway through her testimony when the trial broke for the weekend. So she is asked. So we're going to start right from when the doctor comes back to resume testimony. And Mr. Johnson Casey asked if her opinion rests significantly on the evidence of Dr. Alison Armour, the Home Office pathologist who conducted the post-mortem on baby Preston Davey. Dr. Gifford says yes and no, and explains she looked at the photos provided to her before reading the expert evidence provided to her. Now, Dr. Gifford mainly deals with cases involving living children, and she produced a diagram of Preston's injuries. So don't forget 40 injuries this baby had. 40 injuries. Now, I don't know if he was looked at when he was, hi Joanne, I don't know if he was looked at, when he was passed over from the foster parent to the two new parents. Was he examined then, and did he have any injuries then? I mean, as I say, babies do fall over, they do bang their head and things. But over 40 injuries is just off the scale, isn't it? So, and I know I keep saying it, but they only had him 4 months, for goodness sake. So, Dr. Johnson Casey refers to the evidence Dr. Gifford gave on Friday, in which she said because of some of the pelvic injuries, Preston would have been really unwell with life-threatening injuries. He had pelvic injuries. The other thing is not only the injuries, but where they were, like the nature of the injuries, a fracture, pelvic injuries. There was what was thought to be a bite mark on his bottom. Anyway, so some symptoms, this doctor said, would have included distressed breathing, diarrhea and vomiting. And the doctor explains that a more severe injury would have more severe symptoms. And she says that some of the symptoms could have been due to asphyxia. So don't forget, she's seen videos because these twonks, or especially Jamie, videoed Preston when he was having breathing difficulties, etc. There's videos of it, and they waited over an hour before on that fateful day. The final day, which was the final day of Preston's life, they waited over an hour before they took him to the hospital, even though he was clearly in signs of distress, breathing distress, because there was a video taken of him. And they had a conversation by message about a kayak that they were selling, as Preston was lying on the bed breathing his last, struggling to breathe, clearly struggling to breathe. They were having a conversation about the kayak that they were selling. This is the sort of people we shouldn't forget what kind of people this is that we're talking about. Even if, I know everyone's innocent till proven guilty, but, to leave a baby in such distress for an hour, well over an hour, he should have been rushed immediately to the hospital. Immediately. But, they didn't want to take him to the hospital immediately because he'd already been to the hospital 3 times, I think, in the forms that he'd been in their care. They didn't want it to come out, the abuse that he was suffering. So they didn't care about Preston. They were just caring about what would happen to them. Just terrible, isn't it? Let's put Preston back up there. Can't look at these people sometimes. So this is the adorable little baby. Let's leave a picture of him up there. He's much nicer to look at. But yeah, frozen in time, like all the other children that disappear or get abused or whatever. Frozen in time, there'll be no more photos of Preston. Won't be growing up, going to school, getting married, all the things that you expect, getting his first job, getting his driving license, etc. So then Mr. Johnson KC says there's a difference of opinion between two pathologists about the extent of some of the injuries. Dr. Gifford's report stated that in the absence of another explanation, the type of injuries were suggestive of sex abuse. Now, the injuries were described in the previous video that I did. I'm not going to go into them again, but let's just say there was bruising at the back of his throat. That things that you can see must be suggestive of sex abuse. So there is some discussion about the cause of injury in children who have been abused or have medical conditions. Crohn's disease is vanishingly rare in babies, Dr. Gifford says. She adds that children with severe constipation do not have associated bruising. And she agrees that the bruising to the back of Preston's throat happened during life. So she said that she agrees with Dr. Armour that the bruising to the back of Preston's throat happened during life. So remember, they were saying that you don't bruise after death, apparently. She agrees it would not have been caused by intubation, as Preston was already in cardiac arrest when he arrived at the hospital on July the 27th, 2023. So don't forget, this little boy, basically, he was already deceased by the time they got him to the hospital. The hospital worked for an hour to save him. They recovered a faint pulse twice, but it just didn't, they just couldn't. He was too far gone for them to bring him back. Then Jamie Varley had a complete meltdown, and he tried to carry on with the CPR, even though the doctors were all worried about him because he was screaming for his mum and, collapsing. The doctors tried to sort of comfort him, which is ironic, really, when you think about what, that it was him who caused it, allegedly. So she says almost all children who have had a post-mortem examination will have had intubation and resuscitation attempts, and her experience of intubating children, including tiny babies on a neonatal ward, is that you shouldn't be anywhere near the area that was injured with medical equipment, she says. The doctor says the pharynx area is nowhere near where the tubes would need to be. And she says, I don't think it's likely to be caused by intubation. I'm not saying never, but it would be poor technique in difficult clinical situations. I'm never going to be able to pronounce that. Pharyngeal bruising only occurs in particularly difficult intubations, she adds. So then Dr. Aubrey said, who's Dr. Aubrey? So we've got another doctor now. Dr. Aubrey said she noticed milky vomit at the top of the airway while she was intubating Preston. She had to put in a suction and accepted she may have put some pressure on the back of his throat, she said. And Mr. Kennedy asks, is that relevant to your view on this matter? And Dr. Gifford says she wasn't present at the resuscitation, but the bruising to his throat would rely on Preston having circulation at the time of pressure. There was no bruising around the sites of other medical interventions, such as needle entry points, the jury was told. If there was circulation to cause bruising to the throat, Dr. Gifford said she would have expected bruising also around other points of medical intervention. So Mr. Kennedy asks, is it possible that medical evidence cannot be excluded? And Dr. Gifford says there is a large bruise due to trauma, and medical intervention is less likely but not impossible. Injuries to the palate and pharynx are reported in cases of sex abuse, she confirms, and Mr. Kennedy asks if the absence of injury to the palate is a relevant consideration. However, Dr. Gifford says sex abuse frequently leaves no physical signs. Most sex activity, consensual or not, is not sufficient to cause injury. So it's very difficult, isn't it, to prove because, apart from the photos, of course, though there's not photos of the actual sex abuse, just strange photos, that tell a story. It's very difficult to prove this kind of thing, 100%, because nobody else was there. If it did happen, nobody else was there except for Jamie Varley and Preston. And, even if Preston was still alive, he wouldn't be able to talk about it. So, Mr. Kennedy Casey is now asking about the hospital attendance on May the 25th, when Preston was floppy with possible seizure activity. So don't forget, there'd been several other. This is what makes me really angry, is they'd already been at the hospital a few times because of, Preston was unresponsive, or, this wasn't the first time that they'd had to take him to the hospital. Why was this not picked up on? I just don't understand. Yeah. Yes, this is heartbreaking to the biological. Now, we don't know why Preston couldn't be with his biological parents. We don't know any, they've either volunteered him to go into care, or maybe he was taken off them. Maybe there was substance abuse, or, who knows we don't know why Preston ended up in care in the first place. Seems like he was taken off his biological parents immediately he was born. And then, so it is heartbreaking for them, because for whatever reason, maybe they wanted to look after him and he was taken off them. Maybe that they were unfit to look after him. We just don't know. But one thing we do know is, for the foster mom, it just must be heartbreaking. We're going to hear from her in this video. She does give her testimony. So when he was admitted on May the 25th, medical notes said he had shortness of breath, increased work of breathing, he was floppy, unresponsive, and had a nosebleed, the jury is told. Shaking limbs and stiffness were also noted, and he was treated with seizure medication. 2 days afterwards, Mr. Varley messaged a group chat with Preston's former foster parents, saying that the baby had been really poorly with a nosebleed and had had a seizure in hospital, report here. He reported a chest x-ray, came back with a bad infection, and blood tests showed low sodium. Then Mr. Gifford was asked to confirm that low sodium is found in febrile seizures. And Dr. Gifford confirmed that when small children have a temperature spike, it can cause this type of seizure. This is not epilepsy. It only occurs when children have a fever, she says. A third of children will only have one febrile seizure, but others will go on to have further episodes, she adds. The seizure is not a response to the fever, but parents are encouraged to undress the child to their nappy and give paracetamol to bring the child's temperature down, she adds. So Mr. Kennedy then refers to Mr. Varley's police interview, where he is asked about a video of Preston. I'm going to put this picture back up of Jamie Varley that I put up earlier, because I think it's very important. This picture just gives us an idea of this man. How you just literally, why has he changed his look so much? Is it because he doesn't want people to recognize him? Or has he been on holiday and he's quite enjoying not having a baby to look after now? Because it is difficult. Apparently he was struggling. He was telling people he was struggling with looking after Preston. And that he was having dark thoughts and think, I mean, how many more red flags can you have? This is what upsets me so much. 4 months this couple had this child, and all the red flags that were just ignored. But anyway, what can you say? So this is what Jamie Varley said. We were told by the hospital that if he has a seizure, they would normally send us home. It's only if he had 5 to 8 seizures they would investigate. He told officers he had recorded the seizure after being advised to at hospital, and he only needed to get medical help if the episode lasted more than 5 minutes. Well, let's not forget, on the day that little baby died, they left him for well over an hour on the bed struggling for breath without getting medical help. And Dr. Gifford says the normal advice from paediatricians is that a febrile convulsion looks frightening, but is something children will spontaneously recover from. It is not the same as epilepsy and is relatively common. Febrile convulsions are not epilepsy, but some children with epilepsy will have had them, as they are common. And these children may have a low seizure threshold, the doctor says. Parents are advised to video episodes when there is a lack of clarity about whether it is epilepsy in older children, but generally you would not need to video a febrile convulsion as it's obvious. She says generally confident parents of children who have multiple convulsions will strip them to their nappy and give paracetamol without the need to attend hospital. She agrees that the reference to 5 minutes can be part of advice on seizures. She confirms a seizure of less than 3 minutes would fall in the scope of the advice offered regarding febrile seizures. She also said, so now the KC asks her about the report of Dr. Daniel Duplessis, who was the paediatric neuropathologist. And he said, remember we did look at this a couple of days ago, there was no sign of brain injury. And Dr. Gifford explains that a seizure would not cause brain damage as it is an electrical episode in the brain. Now we go on to talk about the elbow fracture. So Mr. Johnson Casey is now asking about the fracture to Preston's elbow, which Dr. Gifford said was suggestive of an abusive cause. And she said it would have been immediately painful and sore for a number of days. And I remember I was telling about my son when he was boxing when he was 15. He fractured his elbow. It was agony, absolute agony. Fractures are complete agony. So Dr. Gifford confirmed she did not see Preston when he had this injury, and she agrees that some children have a higher pain threshold than others. Hospital records said there were no safeguarding concerns when Preston was taken to hospital with this injury. Dr. Elbow, the orthopedic Dr. Elbow, sorry, just, sometimes you get these, so poor Preston, supposedly he's fractured his elbow and he goes to see Dr. Elbow. Anyway, there's so many, just life is crazy, isn't it? The orthopedic doctor who examined Preston's x-ray said the injury was a tiny speck. That's what Dr. Elbow said. But Dr. Gifford says the pain of the fracture is not necessarily proportionate to the size of the fracture. Well, I know my son was in absolute agony when he fractured his elbow. Of course, he was older, so he was 15. And your bones are more set then, aren't they? Babies do have more flexible bones, of course. It's not impossible that children with fractures don't scream, but most fractures are painful at the time they are caused, she says. And Mr. Johnson, Casey, puts it may not always be the case that a child screams right away. And Dr. Gifford says it's an unusual situation to have a baby in pain that doesn't cry because that is their primary communication, but never say never in medicine. I mean, yeah, a baby can't do any more than cry, can it? That's how it talks to you. The thing is, babies cry at the end of the day, of course they do. And they cry if they're hungry, if they're thirsty, if their nappy needs changing, if they're just in a bit of a strop. That what else can a baby do? They can't talk, they can't say, oh, by the way, my elbow's really hurting. So they're bound to cry. And of course, it seems that Preston, according to Jamie Varley, of course, he was quite unsettled. But, he'd had quite a lot of changes in his young life. We were saying, he'd gone to the foster mum where he seemed to be really happy. And then he was taken away from her and put with two dads, which whatever you think about same-sex couples, he's gone from a household where there was a female voice and now suddenly there's no female voices, So he would have been unsettled even despite the 40-odd injuries that he had. Because and he would, when babies are unsettled, they do cry because that's all they can do. Anyway, he then asked Dr. Gifford, Casey, Mr. Johnson, now asking about opinions given by Dr. Gifford about injuries seen in photos of Preston. Her opinions are caveated by the fact she had not seen these injuries in person. Though she did say that she didn't see in person, she's only seen photos. The court was shown videos of Preston in the bath, and Dr. Gifford said she noted marks on Preston's head and arms. And in her clinical judgment, Preston seemed content, and there was some cooing and vocalising in those videos. There was also socialisation, smiles and eye contact, she says. Mr. Varley could be heard interacting inappropriately with Preston, using a higher pitched voice and praising his motor skills when he turned around. And Dr. Gifford said these were typical interactions between an adult and a child this age. And then she was asked about nude photos of Preston. And Dr. Gifford said that nudity in itself is not a concern. Babies often have nappy-free time, and parents often take pictures of a child in a paddling pool, for example. Then they discussed baby Preston's squint and how it could have affected him. So the jury is told it is an agreed fact that Preston had a squint, a condition that can affect depth perception and cause overbalancing and clumsiness. Dr. Gifford was asked whether she agreed that the condition could lead to more bruising than another child. However, she said a lot of babies at 13 months will squint. She would not expect babies that age to have developed depth perception anyway. At that stage of development, they would be falling over as they are learning to walk and have not developed their motor skills, she says. She says the condition does not increase the force of the falls, and she would expect a baby of 13 months to be falling over multiple times a day, with or without a squint. And she said that older children may misjudge the depth of the stairs. Now they come to talk about the bruises on Preston's thighs. 5 linear bruises were noted to Preston's left thigh during the post-mortem examination. Mr. Johnson asked about the doctor's evidence that this was an exceptionally forceful slap or a grip. And Dr. Gifford explains the presentation of a slap mark and how it may look different if it was particularly forceful due to the pattern of the mark. In her opinion, she says the injuries were more suggestive of forceful grip marks, although she can't rule out a slap. Dr. Gifford also says it's more common in her child protection work to see children who have been gripped on the arms or legs. Slaps are predominantly to the bottom or the face, she said. So they go on to talk about the slaps or the marks, and she confirms that she thinks they were grip marks rather than slaps. Then Mr. Wright, Casey, asks what Dr. Gifford meant when she said that nudity in itself was not a concern to her, and she explained that babies have no inhibitions and are quite comfortable being naked. What else then he asked her what degree of force would be required to cause a fracture to a child, and she says that, for example, if a parent were to fall on the stairs and catch a child, that could be an acceptable explanation. Also in road traffic accidents, or if a child has been falling from a height, it might be seen. She says it would be more than a normal domestic accident or playing, throwing or dancing with them, the doctor says. And Mr. Wright asks, what about putting a child to lie down in the cot? And Dr. Gifford says, no, I wouldn't expect that to cause this. What about holding both arms but losing the grip on one arm so he goes down into the cot from standing or seated position while holding onto the left arm? I mean, he's really, scraping the bottom of the barrel here. And the doctor said, no, I wouldn't expect that to be sufficient. What about getting him out of a car seat? He asked. No, she says. That is a daily event. I wouldn't expect it to cause a fracture. So then Mr. Wright was asking about febrile seizures, which need a fever. And on May the 27th, Mr. Varley gave an explanation of the hospital admission a few days earlier in a group chat. He said, I'm going to take his photo off actually. Again, I've just realised I'm going to put Preston back up there. We'd rather look at Preston, wouldn't we? I can see your messages. Hi, Daniel. Yeah, I can see your messages okay. Joanne, have you got your sound back now? Has anybody else not got sound? I take it you have got sound now.
Joanne, have you got
your
sound back now?
The sound's definitely working because I've just checked it on my phone. So, yeah, but we've been talking about that, Joanne, isn't it? Yeah, what's the vetting process for these adoptive parents? It's obviously not good enough, is it? Okay, so when Preston was taken to the hospital on May the 27th, Jamie Varley gave an explanation of the hospital admission a few days earlier in a group chat. He said that Preston had a nosebleed when he was changing his nappy, and then he went unconscious. So this is what he's saying. He literally had a nosebleed and went unconscious. But Mr. Wright confirms there is no reference to a fever in the message. However, there is reference to low sodium and an infection. So basically, Jamie Varley was saying he'd had one of these seizures, but what they're trying to say now is it wasn't a febrile seizure because he didn't have a temperature or whatever. Anyway, then Dr. Gifford is shown a video of Preston from May the 15th. She says there does not appear to be any sign of a temperature such as redness or mottling. However, she cannot feel the child. So yeah, it's important to remember, and she does keep reminding us, that all the evidence that Dr. Gifford gives, they're from photos and videos. She never actually examined Preston herself. So in this video, apparently Preston was alert. He had signs of respiratory distress in the video. And then she was asked about bruising when Preston was admitted on July the 27th, and she explained that needles, which were inserted into Preston's shins, were a traumatic procedure. She would expect bruising around the site if there was circulation present when the procedure was carried out. And that was the end of her evidence. So now we have the evidence from the foster carer, Sandra Cooper. I think this is very, 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 I've read through it briefly, and I just feel so much for Sandra. And you know what, Jamie, he does try and cast aspersions on Sandra, which I think is disgusting, to be honest. But anyway, so she looked after Preston from the age of 5 days old. So Sandra looked after Preston from the age of 5 days until he was placed with the defendants in April 2023. Simon Driver was asking questions on behalf of the prosecution. So Preston was discharged from hospital on June the 22nd and placed with Mr. and Mrs. Cooper. This is 2022. So he was in hospital then. That I don't know. I don't know whether he was in hospital because he'd been abused then, or was he in hospital because that's where his mum had him, and maybe there was some, he was kept in. We don't know the reasons for that. But he was placed with Mr. and Mrs. Cooper, who have been registered foster carers with Oldham Council for 27 years. That's a long time, isn't it? So, they've fostered a lot of children, I would imagine. So that was on June the 22nd, 2022. And then nearly a year later, so they had him for quite a long time, on March the 9th, 2023, the adoption was approved and an introduction process began on Thursday, March the 23rd. Mr. Driver asked about the introduction process. So apparently the first part took place in the Cooper's home and involved Mr. Varley and Mr. McGowan-Fazakerley, the ridiculous surname, double-barrel surname that the other partner has got. They were shown how the Coopers looked after Preston and his routines. The second part of the process took place at their home in Blackpool. Mrs. Cooper spent time in the home with the couple to help them and Preston to adapt, the jury is told. She slept at a nearby hotel so she could be on call for any issues which might arise and to gradually wean herself away from Preston. The court hears. Dear me. Sad. In June 2025, Mr. Varley was interviewed by the police. He was shown a series of video recordings, including one made on May the 19th, where Preston appeared to be playing naked on a mat. And Mr. Varley said this was free willy time, which is what he said the foster carer called it. So see how he's, now she denies it, so we'll see that in a moment. Now, he says, and you've got to think, who do you believe? I have a tendency to believe the foster mom rather than this idiot. But anyway, allegedly, the alleged culprit. But so he said this was free willy time, and he said it was described as that by the foster carer. He said that Mrs. Cooper put him in the cot and left him to it. So Mr. Driver asked the witness, have you ever used the phrase free willy time? And Mrs. Cooper says, never. So she denies it. I mean, I just don't know what to make of that. I just cannot, I find it difficult, Jamie says, but, I suppose it's his word against hers, isn't it? And so Mr. Driver asks, is it your practice as a foster carer to allow babies and toddlers in your care to have periods of nudity? And Mrs. Cooper says, no, never. It's a big safeguarding issue for us. I have a house with other children and people coming in and out. I have a specific baby changing area downstairs and another in the child's bedroom. I would never even change a nappy in the living room in front of other people. So that's what she says. Now, I would just imagine that someone who's been a foster carer for all those years, if they were going around describing the free willy time, there'd be other people that had taken babies, from her care that would know about that as well, wouldn't there? Well, if that really is true, what Jamie says, wouldn't other people be able to verify that? I don't know, just a thought. Well, it's up to the jury to decide who they believe. So she says, it's just not something I would ever do. I never have. As when Mr. Johnson asks her if she would ever allow nappy free time just to let air circulate. But Mrs. Cooper insists it is just not my practice. It's just not something I would ever do, never have. And Mr. Johnson asks if it is not something other foster carers would do. But Mrs. Cooper says it's not just a practice she would do. Now, for those of us who have either got children, had children, or I'm just trying to think about it. I mean, when you're changing your child's nappy, you normally do let them have a little kick around. I don't know, and also for me, I think because of living in Spain, of course, it's a lot warmer. It's a lot warmer, and maybe on the beach or something, you would let your child wander around with no nappy on. I don't know. I can't even think about that. It's not something I've ever thought about. Suddenly now I'm like paranoid about it, thinking about it. But I think it's different if you're a foster carer because, like she says, she's got other people in her house, other children. She's got the thing is that the babies that go into her care are all the children. They're not the biological parents, so there is a safeguarding issue. Because you're bound to be more careful, I would think, because you don't want anyone to accuse you of anything. You'd be sort of more conscious of it. I think if it was your biological child, maybe you wouldn't even think about it. I don't know. But let me know what you think. Yeah. She says in under oath, you're safeguarding yourself, your husband, the child, and everybody. So Mr. Johnson says that Mrs. Cooper contacted the director of social work to vehemently deny that she had ever done that. She also contacted the police. And Mr. Johnson says, the truth is you did tell both defendants you do this from time to time and that you sometimes gave him free willy time in the cot. And they found it amusing that you call it free willy time. But Mrs. Cooper insists it was not something she would say. So what do you think? Who's telling the truth? So, of course, there's two of them. So are they both saying, Jamie Varley and his partner saying that she said this? And then you could think, well, they would stick together, would they? Or maybe they are telling the truth. What do you think? Anyway, Miss White, Casey, says this conversation took place in Preston's nursery and she referred to situations where it was comfortable for a baby to be without a nappy before bath time. Mrs. Cooper says she does not know why anyone would leave a child without a nappy in a cot they are going to sleep in. And that's right, you wouldn't, the only time you would leave your child without a nappy is on the changing mat or on floors that would be easy to clean because, I don't know if, as I say, if you've ever had a baby, you know that as soon as you take the nappy off sometimes, they just decide they're going to have a wee, and maybe it's the feeling of the air or whatever. And, it's just, they think, oh, this is nice, got the nappy off, let's have a wee to celebrate. I don't know what the reason is. But they do it. So that's why you have changing mats, isn't it? because you don't want to be cleaning. I mean, we don't have carpets here in Spain, but in the UK, if you've got your carpet down, you don't want your baby lying on the carpet and weeing on it. So you're going to do it on a changing mat or a hard surface where it's easy to clean, tiled floor. So that would be cold on the baby, wouldn't it? So yeah, that's what changing mats are for, isn't it? You certainly would. I would never in a million years. So the cot that the baby is going to sleep in, you wouldn't let it go without a nappy there, because if it weed in there or something worse, even a number two, that how are you going to clean that from a cot mattress? So that makes sense to me what she's saying. If you were to give your child a little bit of air, like in between changing nappies or whatever, it would have to be on a surface that was easy to clean, wouldn't it? Just would have to be. So anyway, on June the 11th, 2025, Mr. McGowan-Fazakerley was arrested on suspicion of child neglect, sex touching and allowing the death of a child, and he was interviewed under caution at Blackpool Police Station, and the first of his interviews is now being played to the jury, so we're going to hear what he says. Just come back to chat, make sure you're all okay. Yeah, you've got your sound now, Joanne. Good. So now we're going to talk. So this is now what the partner had to say. So McGowan-Fazakerley. Let's put a picture of him up just so that you can visualize him, because he's, just reading between the lines, it seems to me in this partnership between Jamie and Fazakerley, I think that Jamie was the dominant partner, more dominant. Just feels like that, doesn't it? But it does seem that, photos and videos were exchanged between them. And although this guy was at work a lot of the times when the abuse was happening, doesn't mean to say didn't know about it or even participated in it on other occasions. I just can't believe they kept silent. Having said that, was this guy that finally decided to phone the emergency services, wasn't it? But then he put the phone down and the emergency services had to ring back. And then they had to be persuaded to take Preston to hospital. I mean, to me, your baby is lying on the bed and can't breathe. You don't need to phone emergency services to tell you to take him to the hospital, do you? I don't think you need emergency services for that. You just pick him up. He's a baby, for goodness sake. He's easy to take in the car. It's not like an adult where you'd have to wait for the ambulance because you couldn't get him into the car. This is a baby. You just scoop him up as soon as he really showed signs of difficulty. Like that doctor was saying earlier, what did she say, 2 minutes or 5 minutes? Not an hour and a half that you just leave him there struggling for breath. And then you have to have the bloody emergency services tell you to take him. But that's what these two twonks did. They just left him there chatting over messages about their bloody kayak that they were selling. It's terrible, isn't it? I can't get into it because I just get so angry and I'll start swearing. So he says in his police interview, he is not responsible for any of the offences he is charged with. And he gives an account of the events of July the 27th. He says they woke up about 7 a.m. and had a meeting with a mortgage advisor at a service station on the M61. They had arranged for Jamie's mum to have the little one while they had the meeting. He remembers the baby was sick in his high chair after breakfast. They were running late, so Jamie asked his mum to bathe the baby because he'd been sick. They went in separate cars to Jamie's mum's, and dropped him off, then drove to the service station for the meeting. Now we know how Jamie loves his mum, doesn't he? He was crying for his mum at the hospital. And the other thing that we know is that just hours before he died later that day, this little baby was being dangled on his grandma's knee, and she was singing to him, "Clap handies, Daddy Comes," which is a very popular song that you sing to babies, sort of bouncing them on your leg. Clap handies, Daddy Comes, with some cakeys and some buns, all for Preston. It would have been Elijah, because they changed his name to Elijah. It just makes me cold to think of that. I don't know how this Gmail thinks about it. What does she think about her son? Knowing that there she was 1 minute singing that song to this little baby, who at the end of the day was her grandson. And then within a few hours he would be deceased, allegedly at the hands of her own son. So they had Burger King, and then Mr. McGowan-Fazakerley went to his office in Salford Quays. Jamie got back in his car and went back towards Blackpool. Mr. McGowan-Fazakerley left the office, headed towards home. He left with another colleague at around 4:55 p.m, then went to his own car. The defendant says he usually leaves about 3 p.m. because of the traffic, and that day the traffic was bad. He would ordinarily ring Jamie when he was coming on the M61 to give an ETA and ask if anything needed picking up. So yeah, this time really, Jamie is the main caregiver because he's taken a year off work. He said he remembers speaking to his partner on the way home, and he remembers a quick, short, normal conversation, nothing to portray any distress. But when he got home, he parked the car, the door was locked, and he could hear the dog barking. Mr. McGowan-Fazakerley says he doesn't know how long he was at the door, 20 or 30 seconds. And then Mr. Varley opened the little one's window at the front and said, "Come in, I need your help." So don't forget, this is his account of what happened. So he let me in, he ran downstairs and said, "Come on, I need you, I need you." The defendant tells the police. We went into little one's room. I don't like the way he keeps referring to him as little one either. He's got a name, whether it's Preston or Elijah. Why does he keep saying little one? It just feels horrible to me. We went into little one's room. Yeah, Elijah's room or Preston's room. It's like he can't speak his name. The smell of sick just hit me, he said. He was on the floor, sat up, and he was being sick. Bless him. Jamie was with him, rubbing his back, and he was being sick. He'd already been sick before when he was on his mat. We said we need to take him to the hospital. We live around the corner. We weren't going to call an ambulance because by the time it came, we would have been there half an hour ago. Yeah, but you'd still waited. Anyway, never mind. It was important we took him to the hospital. Yeah, no shit, Sherlock. Should have taken him to the hospital 2 hours earlier. He then suddenly went limp, going from his room to the car. Jamie had no shoes. I quickly grabbed some shoes because I needed to drive. Well, why haven't you got your shoes on? You've only just arrived home. They're probably one of that, probably as soon as they walk in through the door, they take the shoes off. But, that baby probably went limp when I think that baby just gave up. It was just like, hopefully, Jesus came and got him out. I know maybe you don't believe in these kind of things, but I just hope somebody swooped down to get that baby and take him away from those horrible men, allegedly. We drove to the hospital. I said in the car, "What's happened?" He said he was in his bath seat and then you were home. We pulled in at the hospital and one of the paramedics came and took him out of our hands. And then don't forget, at the hospital, they worked on that little boy for over an hour. managed to get a faint heartbeat up twice, but could not save him. So Mr. McGowan-Fazakerley explains that Preston had acid reflux and was on medication for the condition. What, on medication at 11 months old for acid reflux? What's he talking about? Oh, dear me. Yeah, but that's what I'm worried about, Julie. You know, at the end of the day, this is a he said, she said type situation, isn't it? Where, you know, what will the jury make of all the evidence? You know, what sort of sentence will they get? They're going to get, I think they're going to get found guilty of something, but whether they'll get found guilty of murder, which really is murder, isn't it? It's definitely manslaughter, child neglect, etc. But what sentence are they going to get? And that's why I think everybody should know who these people are, because if they ever come out, maybe they'll only get 10 years. You know, they're going to be in their 40s when they come out. I just want everybody to know who they are, because they're horrible people. And, you know, they hide in plain sight. Monsters hide in plain sight. The devil works through people. Well, I 100% believe that. There's evil in this world. It's like working through people. And the devil certainly did it through these men, allegedly, of course. So he says that the baby did not have any injuries, and apart from being sick, was not unwell that morning before they went to the meeting. He describes it as a normal day, a normal morning routine that we did with our son. He says they had 2 kayaks that they bought during COVID, and they didn't want to move with them when they moved house. So they put them on Facebook Marketplace and had a few people messaging about them. He says there was a phone conversation with Jamie while he was driving home. He said he would always ask if he needed to stop at Tesco's to pick anything up on the way home. But he says that day there was nothing abnormal about their conversation. Nothing was said about Preston. So bear in mind, all this was going on. While all this was going on, Preston was breathing his last on the bed, and you know they were having normal conversations. He doesn't remember if he asked about Preston, but he does not recall Mr. Varley saying anything of concern about Preston. Mr. McGowan-Fazakerley. Well, and also though, I don't know about you, if I'd worked all day and my partner was looking after the baby, the first thing you'd say to them is, "Oh, how's Elijah been today?" Or you want, this is not, they've only had this baby 4 months. Surely your first question to your partner when you've got a young baby in the house is, "Oh, how's it been with whoever?" You want to know about the baby. F the kayaks. You might come on to that conversation, but first of all, you'd be like, "Oh, how's the baby been today?" And have you had a nice day with Elijah? Or put him on, let him hear my voice. That's something that you would do, isn't it? Or put the phone to his ear and let me talk to him. I do that with the dogs, never mind the baby. But he doesn't even remember if he asked about Preston. So he said he had no concern that anything was the matter with Preston before he arrived home. That's what he said. I don't believe him. The journey from Salford Quays to home would take just over an hour, but not at 5 p.m. He also says he stopped at the services that day and there was traffic getting onto the M61. I wonder why I stopped at services. Anyway, so when he arrived home, he says he parked his car on the drive at the front of the house. The front door was closed and locked, so he knocked and he heard the dog barking. Then Jamie opened the upstairs window. He was in distress, he says to the police. And by the time he opened the door, Jamie was halfway up the stairs saying he needed help. Halfway up the stairs? Wasn't he already upstairs anyway? I walked upstairs. The bedroom door was open. I walked round the stairs and into Preston Elijah's room. He was on the floor. I think he was on his sheepskin rug. There were towels there, so he had just had a bath. That's what I can describe. Jay was on the floor with him. He was being sick and Jay was patting his back, saying, "It's okay, don't worry." The officer asked about Preston's position, and Mr. McGowan-Fazakerley says he was sat up facing the door. God, that poor baby, he's a lamb to the slaughter with those two men, not really concerned about him, just concerned about kayaks. And, you just feel like he was just left out there to dry, really. It's horrible. The defendant said he could see his partner with the baby. Preston was sitting up being sick, he says. Mr. McGowan-Fazakerley says Preston was sitting by himself as he could hold himself up. Jamie wiped the sick away and they said, "We need to dial 999. But Jay shouted, "John, no, we need to go to the hospital now." Now we listened to the 999 call and Jamie was saying to put the phone down. And he did put the phone down, and then the emergency services had to ring back. Anyway, he says Preston's eyes were open while he was sitting on the floor, but from the time of being scooped up, he started to go a bit limp. I just don't believe it. I don't believe any of that, So we're supposed to believe that he was actually sitting up with his eyes open, and then when they picked him up to go to the hospital, he suddenly went limp. Absolute cojones. Jay picked him up. He was in his pajamas and he ran. He was in his pajamas. I can't, if you remember, he had the Rupert Bear trousers on and the Jurassic Park t-shirt on, a man of nearly 40 years old. I can't remember. I think he said it in the car. He said he'd had him in his bath seat because he was sick at my mother-in-law's that afternoon, which I didn't know about until maybe a day or two later. So now they're saying he was sick at the grandma's, so it's obviously her fault. He said he was in his bath seat. Jamie was in the shower, got out, put pajamas on, and he wasn't in his bath seat. So he scooped him up. I'm finding it difficult to say what he was saying, but he explained to me he was in his bath seat and he got out and he's been sick and you're here. It was very stressful. Oh, didn't. So he said it was both our decisions to take Preston to hospital. He was being sick and he went limp seconds after I arrived home. The defendant says he doesn't know if Preston went limp when he was in Mr. Varley's arms or in the car. He was already limp. That boy was dead before they took him to the hospital, probably. Jamie was saying, slow down, because they hadn't put Preston in a car seat. Oh my God. Oh, yeah, make sure you put him in a car seat. Well, he's dead, but, get him in a car seat because we won't want anything terrible to happen to him. He was unwell. He kept on being sick. We needed to take him to hospital, so we took him to hospital. The defendant says he doesn't remember what Preston was wearing at the time, but Jamie had just changed his nappy. He doesn't recall what the baby was wearing, but he thinks just a nappy at that time. And Mr. McGowan-Fazakerley is asked to describe how he describes limp. He couldn't hold himself. He was unresponsive. He needed medical help, he says. So the jury are watching the defendant's interview with the police, and en route to the hospital, Jamie just said he got Preston out of the bath. He was out of his bath seat and just being sick. He says he didn't see Preston have a bath. He assumes he had because there were towels in his room. Preston's hair was curly. He didn't have anything on and he was getting put into pajamas. He hadn't actually seen him have a bath, but Mr. McGowan-Fazakerley says he thought he had. Preston wasn't sick again in the car. No, do you know why? Because he was dead. That's why he wasn't sick. But make sure you had him in the car seat, hey? He didn't sit up or anything, he told police. Oh my God, it's the biggest load of lies I've ever heard. The defendant said he didn't know if Preston was breathing in the car. At the hospital, Jamie passed the baby to paramedics, and Mr. McGowan-Fazakerley says he thinks he heard somebody say they needed resuscitation. It was hell, he says. The whole thing felt like it was in a soap opera. Jamie was running round like a headless chicken. It was horrendous. He kept saying it was all his fault. He had put him in the bath seat to put his clothes on. He was screaming and shouting, and I just went into shock. Do you know what? Through all the interviews that I've seen with Varley, and now listening to this guy's interview, they never really talk about Preston. How we could, we just thought the poor little guy, what's up with it? It's all about them. He went into shock. Jamie's running around like a headless chicken, crying for his mum. It's all about them, isn't it? Nothing about that little boy who's, I think he was dead before they even got him in the car. And you know what? I think that's the only reason they even took him to the hospital, because he was there struggling for breath for over an hour. They never did anything. And then I think what he's saying, in my opinion, and maybe I'm wrong, but I wouldn't be surprised if he got there. That baby was already dead. He said he was sitting up and then he just went limp. Rubbish. I think that baby was already dead. And then they decided they had to take him, because what else were they going to do? I bet there was quite a discussion about what they should do. But they had to take him to the hospital because they couldn't pretend they didn't have a baby, could they? They couldn't dispose of him and pretend they never had a baby when they're going through an adoption process. Yeah, all they're caring about is them, not caring about little Preston. I don't hear anything in any of these. Hi, Jacqueline. I don't hear anything in any of these statements or any of the interviews that I've seen for either of them. Nothing about Preston, really. Nothing about what he went through. It's all about them. They're not nice people, are they? Not nice people at all. They had a baby. They wanted to adopt it. Well, we'll hear in a minute what they said about how they'd always wanted a baby. Yet for an accessory to abuse. So listen to this. So Mr. McGowan-Fazakerley is asked what made him think it was serious and needed hospital when Preston was being sick. Bearing in mind he was often sick. Because remember, he had 40 injuries. He'd been to hospital 3 other times in 4 months. I think we have to keep coming back to this. These men only had this baby for 4 months. Not 4 years, 4 months. And in those 4 months, he's ended up with 40 injuries and he's been admitted to hospital 3 times. So, bearing in mind he was often sick, he was asked what made him think in this particular instance it was more serious. Of course, we know, or I think, the answer is because he was actually dead, not being sick by then. But he says, listen to this, he says it was parental instinct. Oh my God, the bare-faced cheek of the lies. Parental instinct. They haven't got any parental instinct. He needed medical help, he says. He started to go funny, limp. He wasn't responsive. Being sick, he needed to go. He threw up a little bit, but he wasn't alert. He was dead. I wouldn't be surprised if that baby was dead when this guy even arrived home. You know yourself, if you see someone who's poorly, it was just parental instinct. He needed help. Absolute rubbish. Parental instinct might have told you that your partner was abusing him. So, in another interview, he was asked about the cot in Preston's bedroom. I hope we get to see these videos. We haven't seen these videos yet. We've seen the videos of Jamie Farley. He says he brought the cot online, but he bought the cot online, but he can't remember which store. I just don't believe anything these people say. You know, this is a baby that they apparently really, really wanted. It's their first baby. Everything is a revelation, isn't it? When you have a baby, the first baby. I only had one child, but I remember even now where I bought the cot, where I bought the Moses basket, where I bought this, where I bought that. You buy a lot of things for babies, especially when not so much your second baby, I don't think, because it's just with the first baby, you don't want anything second hand, do you? Or you want everything new. You're so excited that you're going to have a child, but you can't remember where he bought the cot from. I can remember, and it was 30 years ago. He can't remember when he's been interviewed, and he's bought the cot just a couple of months earlier. Can't remember where he bought it from. Must have senile dementia or something. So he can't remember where they bought and if he bought it online, he's only got to look at his. How can he not remember where he bought it from? You just got to go and look at the order. Anyway, never mind. Just can't with this guy. Jamie put the cot together in Preston's room, he says. He says Preston liked being in the cot. He probably liked being anywhere out of the way of them two. He would stand up and bounce in it and have his naps in it. He never cried about being put in the cot. He was just normal. Shame you weren't, isn't it? The cot would be cleaned and wiped down if he did baby things. I don't like the way this man is talking about, if he did baby things, the little one. Woo, the cot would be cleaned and wiped down if he did baby things. It wouldn't be left if it was dirty, he says. Preston's bedding would be washed separately and the bedroom was kept clean and nice. Would you even have to say that? I think when just fact is saying that makes me think, no, it wasn't. Anyway, that's just me. The mattress came with the cot, but not the mattress topper, he says. The first night Preston stayed over, the foster carer brought his mattress topper for him. Mr. McGowan-Fazakerley said he's a bit of a clean freak and he wanted to change the mattress topper, but he couldn't because they'd been told to keep Preston's bed the same. They removed his toys from the cot at night so he wouldn't play unsupervised, but Preston would sleep with his toy monkey George. Oh, poor little Preston. The jury hears Preston would sleep in a baby sleeper bag at night, the defendant tells police. There were a couple of comforters in the cot which Preston arrived with, the jury hears. The dog would run off with them sometimes. So he was then asked about a grey elephant comforter, which he says came to the house with Preston. He says he doesn't know that it had been washed recently, but he remembers one time it had a bit of blood on it because Preston was teething. What? Blood? Because Preston was teething? Oh my God. Do babies, is there blood when babies are teething? Don't think so. I don't remember that anyway, put it that way. The officer asks if the comforter would be used for anything else, and the defendant says the dog, who's called Maximus, by the way, would run off with things and put them under their bed. At night, Preston would have his Teddy George and a couple of dummies in the cot. And he said he didn't know how often the cot would be cleaned or when it was last cleaned. I thought he was a clean freak. A pair of green khaki trousers were handed in to the police, the jury's told. And Mr. McGowan-Fazakerley said they found the pants when they were moving. He was not with Mr. Varley when he dropped him at the police station. He says he can't remember if his partner found him in the washing basket and they hadn't been picked up when the police searched the house. The washing basket would have been up on the upstairs landing. And the detective says he is asking because these are the trousers it is believed that Preston had been wearing on the day he died. The defendant is asked about a hospital admission on May 25th, and he said there had been 2 hospital admissions. So, yeah, in 4 months, there were 3 in total, I think, hospital admissions. One where he had a seizure in hospital and a chest infection, and a second admission when he was taken in with a temperature and had a chest infection. He also went to hospital when he hurt his elbow, when his elbow got fractured. There were no other hospital visits apart from to see the doctor, he says. Oh, in 4 months, oh, no other, only 3 in 4 months. Oh my God. So then he starts talking about the adoption process, and he talks about his relationship with Jamie. He said they'd been together since 2018. They moved in together 2019. By 2023, the relationship had progressed. They felt it was the right time to start a family. He said he always felt he would like to get married first, but he had seen family members have a child first, then get married, so it felt like the right time. I've always wanted children, and Jamie's always wanted children. It just fitted. Careers were in the right place. We were in that house, we were settled, it felt like the right time. He says he rang a couple of adoption agencies to do a bit of research. Then they had a preliminary chat and began the process. They took a break after stage 1 of the process. During the second stage of the adoption process, Mr. McGowan-Fazakerley said they were excited. He found the process very therapeutic because they wanted to take us all back and speak about things, he said. It was nice to speak about things together. Oh my God. Oh, yeah. All about you, isn't it? He says that when Preston came into their lives, it was like everything we wanted. Everything had come true. It's all we ever wanted. He was just so perfect. Of course it was stressful. To us, it was a brand new baby, and you're thinking about somebody else as well. Changing our routine and putting a new routine in place. It was like any process you can have with a little one. Brand new stresses coming into play, making sure his bottles were the right temperature. I don't know, there's just something about the way he talks about this baby that we were happy to give Preston, to give him a home. We wanted to make him happy. We wanted to do everything we could for him. It's all about what Preston could do for them, how it made their lives perfect. What about Preston? I struggled a bit being an only child. Now, this literally chilled me. Jay has lots of nieces and nephews and has been around children being a teacher. His instinct was there. I would say, you know what Preston needs even before he tells you. His instinct was there. He just had it. And I go back to what I don't believe that this man, Jamie J, suddenly in his 30s decided he was going to do this to a baby. Don't believe it. And if I was a relative of his who had entrusted my child to his care, I'd be thinking twice about it all now. God knows what their families make of all of this. So that was it. That was the last bit of evidence given, and the trial won't be resumed now until Tuesday. So of course it's bank holiday, isn't it? In the UK. Yeah, it isn't here in Spain. It's not a holiday here in Spain. So I'll look at his little face. Every time I look at this baby's little face, I just cannot believe. I cannot believe you can look at that face and think of sex, and not just think about caring about him and giving him a cuddle and, looking after him. So don't forget, we heard about other videos where he'd just been left to his own devices. He was distressed, he was whimpering, he had blue lips on one video that was shown, and he was hanging on the edge of the cot. Then another one, he was left in the bath and he was distressed because he'd slipped. 14 minutes he was left in the bath. 14 minutes. Don't leave a baby in the bath for 14 minutes. Now, he was being videoed, and like had Jamie gone off to, I don't know, go off to do something else and just left the phone running, or was he actually there watching him in the bath for 14 minutes? In which case, why did he not run to him when he started getting upset, when he slipped and he was whimpering and crying? Just carried on videoing him. It's just, do you imagine that? You might put your baby in the bath, and maybe you would take a video of the baby in the bath. And then as soon as that baby started getting upset, you would go and comfort them, wouldn't you? You wouldn't wait for 14 minutes. Just unbelievable. So he's twonk number one. Look at the difference in his appearance. I think he's deliberately hiding his appearance so people don't know who he is. So in a year, I presume it can't be that long afterwards. This is his first interview, I think, with the short dark hair. And then suddenly he looks like he's just come back from Ibiza with his sun-streaked long hair. That in that interview that we watched yesterday, I think it was, or the other day, he just kept tossing his hair back. And now he's got facial hair as well. So he's either hiding his appearance, or he just don't give a shit about Preston. He just fancied a new look. I don't know. It's weird. And then you've got twonk number two, who keeps referring to him as little one. Oh, the little one's window, the little one. Oh, no, making sure his bottles are warm enough. Just like that, the way he talks to Preston, again, it's all about him and Jamie being just working on instinct, and he's just got that parental instinct. Just horrible. Oof. So we're going to see how this case goes. We're going to follow it right to the end. I hope Preston gets justice, because you know what? Something happened to this boy. You're not with someone for just 4 months. I still can't get over it that somebody could adopt a baby, and within 4 months they've got 40 injuries. They've been admitted to hospital 3 times. Suddenly they're having seizures, which they never had before, from what we can gather. They're casting shade on the foster mum, saying it was her that talked about free willy time, to try and excuse the fact that they've got all these inappropriate photos of Preston's genitals, which, don't forget, Jamie was saying, oh, I took them because I wanted to show them to Jamie when he's 18, 20 years old. Of course you would. You've got a little girl, little boy, when they're a baby, you take photos of the genitals because you think, oh, that'd be good to show them when they're 18 years old. Oh, they'll love that. Really, are people supposed to believe that he took these photos of this baby's genitals? Many photos, explicit photos of his genitals, but he did it for Preston because he wanted to show him those pictures when he was 18, 20 years old. Like he'd really thank him for that. Like just a teenager Oh, by the way, picture of your baby showing off your cojones. You know, and he goes, oh, thanks, Dad. How caring of you to take those pictures for me. You know, how thoughtful you were, because you knew I'd want to see those pictures of my genitals when I got to be 18. We're supposed to believe that, you know. Anyway, well, we'll see. I hope the jury isn't falling for all this. It feels like that to me. Allegedly, until proven guilty, they're all those things. But one thing that they are guilty of, and I think it's beyond reasonable doubt, is there were 40 injuries on this baby that within 4 months of them adopting him. It's too much of a coincidence, isn't it? Probably in the whole time. And like, as I say, babies will pick up bruises and things like that, but 40, you know, that might happen in the whole sort of first 5 years of your child's life. Even then, you know, it's not going to happen within a 4-month span. And what a coincidence, you know, no bruises before, and then just suddenly gets adopted by these two twonks, and all these injuries start, the seizures start, you know, Preston's unsettled. Oh, this poor baby. Anyway, you just hope now. Well, you know, to be honest, it's a good job he's not in their care any longer, because that wouldn't have stopped, would it? You know, I just feel, how long would this abuse have gone on for if something wouldn't have happened to Preston? You know, probably until he got old enough to tell anybody about it or to realise what was happening to him. That this abuse was happening. I think they got this baby to abuse it. I think that's the whole point. They didn't get the baby because they wanted to give him a great life. They haven't even mentioned that, have they? You know, it's all about them. They haven't said, you know, that they were thinking, you know, Preston did need a loving home. You know, for whatever reason, his biological parents couldn't look after him, either through their choice or through the choice of the social services. So he needed a home. He needed a loving home. But they didn't, they weren't adopting him so they could give a child a chance. They were adopting for their own selfish reasons. You know, and part of which I think was to abuse him. I think that's deliberate. Anyway, as I said, we'll keep following it. So this won't carry on. So, it's, what, till next Tuesday? So there won't be, that's a whole week. The trial will resume at 10:30. Oh, no, that's today. So it will have resumed today at 10:30, or it will resume today at 10:30 British time. Of course, I'm in Spain. It's only 9:45. So maybe later on today, or certainly tomorrow, I'll give you whatever comes up at the trial today. So, what date are we on? We're on the 19th. Yeah, it hasn't started yet, recorded. So, okay. So please say a little prayer for justice for Preston, and I hope the men get exactly what's coming to them. I hope they get exactly what they deserve. Thank you for watching. Thank you for caring about Preston. Please remember to like the video, subscribe, please, if you're not already subscribed, completely free, and share the video, because YouTube won't share this video because of the content. So they won't push it out. And yeah, thank you for caring about this little one. I'll see you really soon in the next video. And until then, may your God go with you.